For example, all of us, how many of us here? We are about 70 people here? Yeah. Oh, the lack of oxygen here, you know. So we can't breathe, you know. So I think the 10 of you at the back better stop breathing. Can you stop breathing? So you become cancer cells. So you don't require oxygen. So initial stage was like that. Cancer cells sacrifice the oxygen for us, for our vital organs, so that our vital organs can function. So initially, cancer cells, you are my friend because you sacrifice the oxygen for us to live. Right? Now, therefore, we are producing 10,000 cancer cells every day. Every day. And you need a good blood circulation, your good healthy immune system to remove cancer cells on a daily basis. If you don't remove it, your cancer cell will accumulate. It will accumulate and turn into a tumor. Now, throughout my gramotherapy experience, I have been in gramotherapy DSM for 12 years. I receive mails all over the world. So every case study, every patient is my case study. Now, I see a lot of cancer patients. They went through surgery, chemotherapy, and radiotherapy. It is said to say a lot of patients from Europe, after the completion of the treatment, 6 months later, they have relapsed. I see it's very high rate there because of their eating habits. Yeah. So of course in China, less people have relapsed because they know very well when you have cancer, you have to change your lifestyle. You have to look at what's wrong with your eating habits. So a lot of Chinese, they know. If they have cancer, they know their eating habits is wrong. So they become vegetarian, they eat lots of fruits and vegetables, and they stop eating meat, and the survival rate among the cancer, in Chinese is very high. It's higher. So because they know. So when you do the basic right, the cancer can also win. But we do not know, we are ignorant. Due to ignorance, we thought we're eating the right food, our healthy, our lifestyle does not affect our body. So you are creating an environment for cancer to come. My advice is, now, for healthy people, you have to take the whole range of products on small amount on daily basis to maintain a good body environment to prevent all sorts of problems, including cancer. However, if we have someone has cancer, please help them because you're giving them hope. Patients may opt for to go to the doctor, to go to the doctor, and they had all the chemotherapy. During chemotherapy is the time you need to help them. Why? Chemotherapy not only destroy the cancer, it's destroying your immune organs like bone marrow, so all your and then your organs like liver, kidneys, and so on. So patients are suffering. And worst of all, the chemotherapy destroy our gastrointestinal tract, your mucosa, your stomach, your intestine. So whatever you eat, you cannot absorb. So you have to give them the whole range of product like GL, polysaccharide. It contains a lot in our reishi powder because it contains RG and GL, so as the mycobita. And the GL is a powerful nutrient for your immune system, okay? And it rebuilds the bone marrow. Of course, the lion's mane has to come along. Lion's mane, it repairs all your intestinal lining that has been destroyed by chemotherapy. So it will increase your absorption of nutrients. How much you can give? 10 tablets, 3 times? Or I have given patients with 60 tablets during chemotherapy. And even the whole bottle is 120 tablets without side effects. So this is your powerful tools to help your patients, to help the needy one. Okay? Then of course, you also have to give them nutrients because when they are on chemotherapy, they have poor appetites. They can't eat properly and they don't have enough nutrients. And the immune system is already weakened and they don't eat proper meals, then the immune system is going to be worse. Then after the chemotherapy, the cancer may come back. So we give them proper food. 30 tablets of spirulina a day or 60 tablets of spirulina a day is essential for them, right? Then of course, you can also, after the chemotherapy, a lot of patients, they cannot go through chemotherapy because of a poor immune system. So with this range of product, most of my patients, they go through the chemotherapy according to doctor's schedule. This is important. For example, doctor say you need to do a chemotherapy, 3 weeks later, rest, you're okay, you have another chemotherapy. And a lot of patients, sometimes they cannot because they have low blood count, either they have white blood count is low, platelets low, doctor say you're 2 weeks for chemotherapy. But however, if you give them this range of product, they are healthy enough to go through the chemotherapy. And after that, you need to prevent relapse. And the whole range of products again, you see Qualifine, Morinzine, RGGL, which is the reishi powder, spirulina, Qualicef, lion's mane on long-term basis to maintain the 4 pillars again. Yeah? Good blood circulation, good immune system, good oxygen, and balanced circulation. Now, prevention is better than cure. We know treatment is expensive. If someone is sick, you go to the hospital, you have to pay a lot of money. Correct or not? Same thing in chemotherapy. If today a few hundred dirham you cannot spend on your body to maintain health when you have cancer, you know how much my patient has to pay? 4,000 to 5,000 dirham for the whole range of treatment. Yeah? You cannot come and say, Jane, I have no money. Because when you're sick, you go to the hospital, you have to pay for the treatment, and you cannot say, doctor, I have no treatment. I have no money for treatment. So you have to do everything basic right. This is free. If you do basic right, then you take some DSM products, you can live a good golden age. Now, I want to know how many of you exercise every day. Please put up your hand. So few only, the rest don't exercise? Why no exercise? No time? No time? Then you're going to end yourself the problem. Now, I want you to know how important is your exercise. Please stand on your feet. Please stand and first on the exercise. Okay, follow me.